Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi and our online audience tuning in thanks to iHeartRadio and Amazon Music Podcasts. We're glad you all could be with us as well. Well, for those who have been concerned about the COVID-19 vaccine, it seems as though it is now rolling out more quickly here in Mississippi. This week, we started with the 65 and over group. But even with the vaccine being out, it can take months for it to reach widespread use among Americans. In fact, a new survey reveals that Americans' greatest concerns about the COVID-19 and struggles to maintain good health are still among their thoughts amid the pandemic, especially for those who are suffering from cardiovascular disease. We're here to talk to us more about that survey. We're excited to welcome Dr. Kirk Garrett to our program today. He's an individual who's been able to look at the data to be able to share some great information with us that hopefully all of us can use. Dr. Garrett, thank you so much for the time. Really appreciate it.
It's a pleasure to be with you.
So, Dr. Garrett, as I mentioned, with the vaccine being out, people are at least, feeling as though there is help on the way. But why is it important to keep doctor's appointments during this time, especially for those who may be dealing with cardiovascular issues?
Well, Cyrus, as we all know, we're so excited to see the vaccine coming our way, but it's going to be a good long time before we're adequately immunized to stop worrying about this COVID-19 infection. Meanwhile, people with chronic diseases like heart disease can't afford to avoid care. Remember, chronic conditions require chronic management, and staying connected with your healthcare provider is of the utmost importance, even during the pandemic.
And I think that is the big thing, because so many people have been concerned about making those appointments. And, as far as that's concerned, I know even for myself, Dr. Garrett, I've been my mom's primary caregiver, so been very leery of her, where she's been going. But how has COVID-19 impacted the way that we feel about going to doctor's offices or even to the hospital?
Well, this recent survey conducted by Sky taught us some important lessons. We found that overall, about 40% of Americans continue to be very anxious about going to a doctor's appointment because of the COVID-19 fear. Even more startling is that when you look at overall population, it's about 25% of people who are anxious. But if you look at the subgroups of disadvantaged populations, like the African American population, the Latinx population, you find that there are much higher rates of anxiety. About 45% of those people report that they are avoiding doctor's appointments currently out of fear of the virus.
I want to talk about that some more, because we're hearing it here in my home state of Mississippi, Dr. Garrett, especially when it comes to the groups that you mentioned, Latino and African American. I mean, do you find that now that the vaccine is rolling out, that then kind of alleviates some of that concern that they had?
Well, it's difficult to know how much of an impact that will have. As we've heard in the media previously, there's a lot of anxiety about the vaccine as well among these same populations. And there's concern that African American groups and Latinx groups, those populations will be hesitant to take the vaccine, and that will prolong their period of risk.
Well, I'll tell you, it is something I think for all of us to keep in mind. Again, it's great news that the vaccine is out. It is making its way around the country, and hopefully we'll be able to get into the arms of those who need it first. And then, of course, the rest of us will be able to benefit. But in the meantime, definitely for those who are dealing with cardiovascular issues, especially cardiovascular disease, making sure that they're taking care of themselves and definitely making sure they're taking care of their health during this time as well. Dr. Kirk Garrett has been our guest for this segment. Dr. Garrett, where can our audience go to find out more information about the survey and the work that you're doing?
Well, please visit secondscount.org, and you'll find all the information about the survey and more helpful information about heart care there.
All right. Well, Dr. Garrett, thank you so much for the work that you're doing, and really appreciate the time today.
Great. Good talking to you, Cyrus. Thanks so much.
Hey, more than welcome. And we thank you, our audience, for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.